Hey everyone, welcome to the Vet Blast podcast. We're actually live here in National Harbor. It's our first vet conference in National Harbor. We're so excited. We're live here filming, and we have the one and only Dr. Heidi Lobprise in the house. What's going on, my friend?
Just finished some great lectures. You had some really neat people here, and you served ice cream.
It was really good. Yeah, it's good. Yeah, we like to feed them. We feed their bellies and feed the brains is what we say.
I like it. I like it.
Veterinary dentists, we want to thank our friends here at Periodontal for supporting this great conversation. And maybe like you, like myself, I want to know a little bit more about this. And so I can't think of anyone better than having a board of veterinary dentists to talk to us about this. So before we begin, let's actually talk about what is it?
Hyaluronic acid.
Oh, okay.
Now, since that's a little hard for me to say, I have trouble with my words, we're going to say HA from now on. Is that okay?
Yeah, perfect.
Okay,
Sounds
good.
to me.
So the thing of it is, HA is a component of the extracellular matrix. So as you look at all cells, it knows this. It's natural to the cells. In addition, it's been used in many different forms for injectable, topical, eye ulcers, you name it. It's really a good compound because it lays a good groundwork to help with healing with endogenous cells.
Fantastic. So what are some indications for it then?
In dental disease, periodontal disease, anything that needs healing. Okay. So if I've done an extraction, it might help with those areas that I want to heal. When I have periodontal pockets and I've done some root planing, especially in those moderate pockets where I want to get the best tissue healing and regeneration, I'll use it there in those pockets. I can also use it in extraction sites and even with some regenerative type.
Nice. I do think of those extraction sites because whenever I have to take out, I don't know about you, for us generalists, when we do those dentals on the canines and those 208s and 308s, and we're like, oh, yeah. We have some of those deep holes that are in there. So I'm sure it would be great to have HA in there.
Yeah. You can use it with that for the soft tissue as well. The thing of it is, it's, like I said, part of the natural system, so you can use it just about anywhere.
Okay.
And working as a scaffolding, it helps support the cells to migrate, to go where it needs to heal, and helps support that healing and the regeneration of the tissues.
Nice. Now, is this a prescription? Is it classified as a medical device?
Well, it's classified as a medical device with the syringe that it comes in. So as we're looking at that, it's really very simple to use. And I think it's going to be a great tool with most practitioners out there. But there's an important lesson I want to teach.
What's that?
You can't just put it in an area without doing proper periodontal cleaning first. Okay. And even in today's lecture, when we were talking about using curettes for doing subgingival cleaning of even mild pockets, hardly anybody uses them. So really knowing how to use periodontal curettes to make that area healthier, and then using the PerioVive in these pockets and these sites to help increase that healing.
Excellent. Dogs and cats?
Dogs and cats,
Excellent.
Absolutely.
And then when you're doing your perio treatment and your co-pack and all of that, is it within is it cost effective from a pet owner's perspective when we're doing this?
Actually, it's been very cost effective for us and cost effective for the patient, but it's also a revenue generator for the practice as well. And I'm going to go back to my last statement. If you know you have an area that you're thinking about using it, then you have to do some additional periodontal work, some closed root planing. That should be added on because it's an important part of the therapy.
Yeah.
Yeah.
I think of Doxyrobe, I think of Console. So me as a generalist, which ones would I reach for? What are indications for them?
Okay, so as we look at the soft tissue pockets, moderate pockets, and we've done our subgingival cleaning, we can think about the parasitic medications. Clinderol provides the clindamycin. Doxyrobe provides the doxycycline underneath, but it's also anticollagenase, so not just antimicrobial. And we look at the PerioVive, placing it there. It's hydrophilic, so it actually binds to the cells. It helps some modulating the inflammation as well, and even some thoughts that it may help bind to some of the nerve endings, so that might help decrease discomfort.
Oh, fantastic.
Yeah.
So maybe less NSAIDs if we're doing some dental nerve blocks and whatnot, less pain medications to go home with them?
Well, possibly less pain medication, but enhanced healing.
Okay.
More than likely. And there's been some good studies on the tissue forms that it does support.
Excellent. And are there any special uses being indicated for PeriVive?
Well, being a non-FDA product, we don't have to worry about the label specifically, but can I tell you something?
Yes, please
Okay.
tell us.
There's a study going on that's looking at putting the HA, the Periovive, on ulcerative conditions. They've used it this way in people to help healing of those ulcers. So we're looking at stomatitis cats.
That'd be great.
And while there are just a few where the owner can't be compliant, getting it on the lesions on a daily basis, there's been some pretty good results with it.
That's fantastic.
Yeah.
Wow. What does this mean to you as a dentist when you see exciting innovation come through the pipeline? This must make you very excited.
Absolutely. Because there's always that niche to begin with where I can educate more.
Right.
So I like that part of it, get those curettes out. But as we look at the Periovive 2, maybe even furcation areas, where we really used to think furcation, extracted. Let's see if we can get these tissues to heal up a little bit better. Looking at the stomatitis issues too.
Right.
And really, if we focus on using this again, it's going to get clinics to look at those subgingival areas, treat them appropriately, use the Periovive in there. We're going to have healthier pets.
Excellent. And where can they learn more about it?
Certainly, Periovive has some good websites, has some excellent resources on their website.
Thank you so much, Dr. Heidi Lobprise. All the great work that you do for us and for the profession, everyone out there.
Well, I'd do anything for you, Adam.
Thank you. That should be a song on Billboard. Thank you to our friends at Periovive for supporting this great conversation. And we'll see you next time right here on the Vet Blast podcast. Take care, everyone.